I think the 3D model is extremely helpful for patient education and for referring physicians, right? So if a referring physician is sending me a patient that they're entrusting me to do a good job on, I get to show them not only what it looked like beforehand, but what it actually looked like afterwards. And the differences in physiology pre and post has been amazing for the referring physicians to see as well. They also get a much better understanding of the patient's hemodynamics and physiology rather than just a quick assessment of this was the lesion and this was a stent. This is much more detailed and everybody wants more detail.
I love so many parts of it, it's hard to choose, but I'm going to choose a couple that I really use all the time, and one is the pullback curve. So typically when you do an invasive physiologic assessment, you have to pull the wire back to see what the pullback is, and then you put the wire back down, and that whole process can be time consuming. What I love about the CathWorks system is I can get a pullback in each of the vessels and know, is it diffuse disease? Is there a particular lesion that's causing that? Was that the lesion I was concerned about, or is the step down physiologically more distal or more proximal? So that pullback curve is very, very useful, and it's really nice when you see that discrete drop, you know that's a discrete lesion that I should be treating, as opposed to a diffuse pullback. And so I find that very useful.
The added benefit of the CathWorks system with Angio FFR, it just doesn't give you the bread and butter basic information from physiology. It doesn't just give you an FFR, it doesn't just give you basic numbers. It gives you also lesion analysis. So I use Angio FFR with CathWorks to determine the best location for my stent. And it also gives me the impact of that improvement or that intervention. Vessels with multiple targets allow me to fine-tune the stenting and the location to the one that has the most influence on the patient's physiology. Is very helpful.
One of the nice features of FFR angio is the lesion impact factor, which you don't get with wire-based physiology. You can certainly do a pullback with wire-based physiology and see how diffuse the lesion might be, see if there are focal areas that drop your pressure significantly. But with FFR angio, you have a very unique tool that allows you to project the impact of specific parts of the vessel. And so if there are multiple focal lesions or just one diffuse lesion, you can really determine how much length of stent you'd like to place.
That measuring tool is very useful because when I do a physiologic assessment, generally to start ballooning, I generally wait for my intravascular imaging catheter. But now that CathWorks has the measuring tool, I know the approximate size of the vessel, then I can start ballooning and even planning my stent if the plaque morphology seems reasonable without having to wait for the intravascular imaging catheter to get set up. So while I still think intravascular imaging is completely critical to PCI, this tool allows me to get started on the ballooning at least without having to wait for the intravascular imaging information.